I'm Dr. Hansa Bhargava, Senior Medical Director for WebMD, and welcome to the 4th episode of this special program, The Doctor's Dilemma of Overcoming Burnout. Today we're going to hear a first-hand story of burnout and how it was dealt with in a positive way. Joining me today is Dr. David Lawson, oncologist at Emory Hospital and a physician who experienced burnout firsthand. Thank you so much for joining us, David.
Thank you for having me. It's a pleasure to be here.
Tell us what happened and how you realized you were burning out.
Well, when I got burned out, as it were, it was before we actually had words for it. And so there was a time when I just didn't really realize what was going on. But the things that I could see now were noticing irritability and anger, and then flipping over into withdrawal and, depression, not being actively engaged with people. Those are the main symptoms that I had. And then when people began describing burnout, it was, in a way, a comfort, that's me, and it's not just me, it's a lot of people.
Now, you turned to CRM and CBCT, and you told me that it really helped. How did you find it, and how did it help you?
Well, it's interesting to say how I found it, because I am not totally sure. A lot of finding the CRM was due to Lindy Grabby, who's very active in teaching CRM at Emory. And so I heard about it through her work and then decided to take the course. The CBCT was, it's more on the campus, and it's more something that we see our spiritual health people are interested in it, and so they were promoting it. And so I learned about it that way.
What aspects of those courses actually help you pivot away from burnout?
I think one of the main things about all of them is teaching little tricks that you can do during the day to keep yourself stable, as it were. Grounding is an example. Like, I'm nervous about doing this, and so I can put my hand on the chair and feel a little bit of comfort from that. And that's been a part of what has been helpful. The compassion-based training was, a lot of it is learning that it's really okay to be compassionate with yourself. That it really is important to take care of yourself, because if you don't, you take it out on other people, basically. And that was one of the big things that I learned.
Yeah, the self-compassion is so important for us in medicine, right? Where we're often told that we aren't necessarily a priority. The patient's always the priority, and we need to be tough and toughen out anything that we're under to give back to the patient. But the self-compassion, it seems, was more about how can you give to others when you're not okay yourself. Would that be correct?
Yes, that's exactly right. Exactly.
So compassion, and then the other aspect of compassion is also communication. Can you tell us a little bit about that?
Well, I was fortunate enough. I started taking yoga, and it turned out my yoga teacher also taught what she calls conscious communication. And it's communication techniques that enable someone like me, an old white Southern male doctor, who's triggering for a lot of people. A lot of people don't like my demographic. And similarly, I realized talking to people from other demographics that I might very well, with good intention, do harm. And I think that's really come out in the anti-racism movement. So learning that communication was, I thought, really helpful as far as establishing or being able to establish some sort of bond with other people, and particularly people that I might not have met in my other life, as it were.
That's wonderful. So the communication, the compassion, they kind of go hand in hand. And one of the modules actually in CBCT talks about that impartiality and inclusivity in terms of talking to people who are different from you, but also understanding that we're all human and we're all one humankind. So do you feel that those concepts have actually helped you emotionally to ground yourself?
I do. I mean, I think being compassionate, and there's data for this, is just good for the soul. I mean, it's good for the psyche, it's good for a lot of things. And similarly, I think being able to be connected to other people is, at least better than I was, is good in the sense that it's nourishing to us as individuals if we can reach out to other people and form some kind of bond, respectful bond with them. So yes, very much.
So that's really interesting because, as physicians in our training, we're often taught to, and you're an oncologist, to almost distance ourselves from, the patient so that we can actually bear it and remain objective. So would you agree that that may not be the best way to connect with a patient?
Well, it's fraught, and there are issues with it, yes. But I do think that it is important that we at least communicate to the patient a sense of personal involvement and caring. And we can't take on all that they bring to the table, but we at least can take on that part that applies to their cancer. And yes, I think it's very important. That is a source of pain, but it's also a source of reward as well. When they do well, it's wonderful.
Absolutely. And we all went into the profession to help others ultimately. So absolutely.
Yes.
There's a lot of doctors and nurses that are now incredibly stressed out because not only were they stressed out to begin with, and I say doctors and nurses, but of course all healthcare providers. Now we have COVID. We have potentially a twindemic where flu and COVID might be happening at the same time. And we have seen that COVID's not going away anywhere soon. What would your advice be to those that are at the front lines?
I think, as you say, the tsunami is coming. I mean, it's already left. It's on the way. You can predict it's going to be here, and very soon. And I think the main things that we can work on as healthcare professionals is that keeping ourselves intact, and well. And I think things like the CRM help with that. But I think also we've got to be very mindful about how we're dealing with everybody we come in contact with. I mean, a lot of burnout really comes from us. I mean, we inflict it on our fellow workers sometimes, often unintentionally, but we do. And I just think we need to be very conscious of how we deal with each other so that we have a truly supportive environment, that people come to work and they feel cared for and they feel heard and they feel appreciated and they have a way to deal with any hurts that come their way, and hurts will come their way.
So you're saying everyone should try to change a little bit to be kinder, more compassionate, almost being the change you wish to see in the world.
Yes, yes.
Let me ask you a devil's advocate question for some of our viewers who might be saying, well, that's great that we should change ourselves, but what about the system? What about the fact that I have all these shifts? What about the fact that I, don't have enough staff? How do you bring that into the picture, Dr. Lawson?
I think that those are very valid concerns, and I really share them. It's one thing to talk about do this and that and the other, but if you get in and you've got a huge number of patients to see and not adequate resources, and some of them suffer because of that, that's going to hurt no matter what we do. All I know to say is that is not going to change really quickly. And if we want it to change, I think the best thing that we can do is to be sure that we stay composed ourselves and that we're able to communicate to each other in ways that we advocate for change, in ways that are good, in ways that are helpful and constructive. Because I think the world needs to hear us. It really needs to hear us, but it won't hear us if we don't communicate effectively.
So going back to self-compassion, going to CBCT, CRM, will basically ground us so that we can be calmer communicators as well, to even advocate for some of these things.
Yes, that's what I think. That's what I hope.
Well, really appreciate your time. Is there anything else you'd like to tell the audience before we finish up here? I want to be respectful of your time.
Well, thank you, and thank you for the opportunity to be here. There's a quote from Martin Luther King Jr. that I recently read. Dr. Chabner had it in an article about racism in the Oncologist. But he basically, what King said was, I can't be all that I ought to be until you are all that you ought to be. And of course, he said that in the context of the civil rights movement. But I'd say back to myself, you can't be all that you ought to be until I am all that I ought to be. And I think that interrelatedness is something that we have to, well, I think it's going to help us a lot if we consider that.
I love that.
It's
so important, especially right now in this sometimes tumultuous world, it seems,
yes,
right?
Yes, yes.
Well, Dr. Lawson, we are so appreciative of your wise words of wisdom and your time. We do appreciate it. Thank you for being here.
Thank you for the opportunity. I'm very grateful.
Thank you for watching this first-hand example of physician burnout. We hope it was informative and helpful to you in your practice. And remember, if you're experiencing burnout, there are ways to get help. Please join us for our next episode when I'll be interviewing the authors of Compassionomics, the revolutionary scientific evidence that caring makes a difference. Dr. Mazzarelli and Dr. Tretiak will sit with me to discuss their book and how it could help you in your practice. We'll see you then.